Come in.
Good morning, Dr. Ullman. My name is Danielle Ullman, and I'm going to be the nurse practitioner conducting your mental status exam today, okay?
Okay.
So let's start off. Can you tell me about your mood and how you've been feeling lately?
Normal.
Okay.
Fine.
No changes that you've noticed?
No.
Okay. So I'm going to start by having you tell me what year it is right now.
2022.
Good. And what month is it?
November.
Good. And what day is it today?
Today is Wednesday.
Correct. And do you know the date?
I believe it's the 9th.
Correct. And what season is it?
It is fall, starting to feel like winter though.
Yes, it is. What country are we in right now?
US of A.
Good. And do you know what town this is?
Gaithersburg, Maryland.
Perfect. And where are we right now currently?
In my bedroom.
Correct.
Which is weird.
All right, so now I'm going to have you remember 3 objects. I'm going to have you repeat them back to me, and then later on during the exam, I'm going to have you try to remember them and say them again, okay?
Okay.
So those objects are apple, pen, table.
Apple, pen, table.
Good job. So next, I'm going to have you start with 100, and I'm going to have you subtract 7 just a few times, and then I'll let you know when you're good to stop, okay?
Okay. So 100,
Yes.
93,
Mm-hmm.
86,
Perfect.
79,
Mm-hmm.
72, 65.
Perfect. Great job. All right, so I'm going to have you name a couple objects for me. Can you tell me what is this object?
Paperclip.
Perfect. And then what is this object?
A ring.
Great. Okay, I want you to repeat this saying for me. No ifs, ands, or buts.
No ifs, ands, or buts.
Perfect. Now I'm going to have you do a command for me. I want you to take this piece of paper, put it in your right hand, fold it in half, and place it beside you. Perfect. Next, I'm going to have you read the command on the top of this card, and I want you to read it aloud and then do the command for me. Can you read it aloud for me?
Oh, sorry. Close your eyes.
Perfect. Okay, and now I'm going to have you write any sentence on this card underneath for me.
I can open my eyes now.
Yes, you can open your eyes. Sorry about that.
There we go. Lots of adjectives.
Perfect.
Oh, sorry, punctuation.
Perfect. Has a subject and a verb. All right. One more thing I'm going to ask you to do. Can you copy these intersecting pentagons for me?
Yes, not well, but yes.
Perfect. They have 5 sides and they are intersecting. All right. Now, can you tell me how are an apple and a pear similar?
They're both fruits.
Correct. So that means your analogy is intact. Can you explain this saying for me? The grass is always greener on the other side.
Other situations or places tend to look better when you're not there.
Perfect. Abstract reasoning is also intact. So tell me, what would you do if you smelled smoke inside of your house?
I would investigate, and if I was concerned for a fire, I would evacuate my family and call 911.
Perfect. Your judgment is intact as well. So what did you have for dinner last night?
Lasagna.
Okay. And then what road did you live on as a child?
Brant Drive, and then we moved to Mitchell Avenue.
Perfect. And if both of those facts are correct that I would verify, then your recent and remote memory are intact. So can you recall those 3 objects that I asked you to remember earlier?
Apple, pen, table.
Perfect. Okay. Now I just want to recap some of the things that I observed during this exam that I wouldn't tell the patient, but that I would document in my charting. During the exam, patient is alert, normal emotion, normal affect, oriented, ×3. Grooming is appears normal. Patient does not appear disheveled. Appearance is also normal, and body language is also normal. Both his writing and motor function were intact during our exam. Immediate, recent, and remote memory were intact. Patient is able to make arithmetic calculations. Patient maintained attention during full exam. Voice had normal quality, pace, and volume. No signs of aphasia were present. Articulation was intact. Comprehension, both written and verbal, were intact. Coherence intact. Mood, feelings appeared normal. Patient denied any changes. Thought process was logical and no hallucinations were present. All right, Dr. Ullman, so this concludes my mental status exam for you. Your score was a 30 out of 30, which is within normal limits. So do you have any questions for me about the exam that we conducted?
Nope.
Okay, perfect. So with that, I think we're done. I'm just going to go chart and talk to the rest of my healthcare team. Thank you so much for your participation.
Okay.